spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Aloha and thanks so much for tuning in here on Spotlight Hawaii. I'm Ryan Kalei Suji, joined by Yunji Denise. It's our favorite day of the week, Aloha Friday. So thank you for tuning in here as we close out this week. Yunji, we started this show and it's called Spotlight Hawaii, not Spotlight COVID, because we want to spotlight some of the issues that are impacting our community. And today we're spotlighting the issue of homelessness and diving a little deeper into what the city is doing to help combat this problem.
Yeah, there's some very exciting new initiatives that are in place, and the person who is leading that charge is Anton Krucky. In his former role, he was the executive director of housing for the city. He is now the director designate of the Department of Community Services, essentially working in both areas. So we want to welcome him in this morning. Good morning.
Good morning. Thank you. Aloha.
Aloha. So we want to get to core in just a moment, but tell us about these two roles that you're essentially now filling and how you're able to run both offices.
So the Office of Housing was really the Office of Housing and Homelessness, and we tried to change the name, but we weren't able to do that. It really is a policy and strategy development office, but we really took on, and what the mayor wanted to do was he wanted to take on homelessness directly, so we did it out of this office. So we were developing the programs and working the strategy for how we would deploy ourselves. The Department of Community Services is a really large department that they deploy much of the federal funds that the city gets. I mean, they have the CBDG money, the affordable housing money, all of the vouchers. We have senior programs come out of there, and also the work programs come out of the Department of Community Services.
We'll dive a little deeper into your dual roles, but I think let's start off focusing right now for the time being on homelessness and the core program. The last time we spoke, you were talking about the initiative as a whole and getting it set up. Can you give us an update of where we stand right now with the program?
So first, let me put it in the place of what it does. So when we try to develop a strategy for how we can address homelessness, you have to take something very complex like that and put it into a way that you can manage all the different pieces that you're going to do. So the way I did that, I looked at what is the decision making on the street. And so when I first got here, we had one HONU site which was locked up with COVID issues, and then Boise Martin, you offer somebody a shelter or they say they don't want to do anything, and that's all we could do. And so I really wanted to work hard on creating more dimensions to that decision on the street. And that's what core is. That's more about the dimension. And then the other part is you have to analyze your capacity. Do you have the capacity if someone makes a decision on the street and we can help them, do we have the capacity to do that? So core is really it's crisis outreach, response, and engagement. And it's an active service that can respond to someone that's having a crisis on the street, right? And so, unfortunately, we have a lot of people that have mental health issues, we have drug issues, and just people in general that are homeless on the street, that they have issues, and we can address that. So it diverts 911 calls, right? So we can free up time for police to do what they really need to be doing at times. It can also offer a longer response. So when an ambulance service or police come to a situation, there's a certain amount of time that they are going to be there. But with core, they can spend longer, right? And take time to work that situation, build some trust. The EMTs can do medical service. We'll have social workers. And then we're going to have a back office in our headquarters that will be working on, can we place this person and what kind of offers can we make them?
I know that the last time Jim Ireland was on here, the program was just getting started. I believe that there are 2 rigs in rotation right now. Can you tell us about just on the ground, how many calls you're able to respond to with the staff and resources that you have at the moment?
So we had a little slowness in getting started, and it really was when we teed this program up. I think I said on the show, I was hoping for August, right? And so we got the money in July from ARPA, but it turned out we didn't get the rules. And so it took the city a couple of months to work out the actual rules that could fund us, right? So I'm happy to announce in October we got all those funds released to CORE, and so right now we're hiring up and building that staff up. But we were able to take 2 trucks and put them into service on October 15th, and a small group that's running those 2 trucks have made their patrols. And so not only do we respond to emergencies, but they can patrol, right? And they can stop and interface. The other thing too, that's a very real thing that happens on the street is someone has a mental episode and police or EMS, they take them to the hospital. And after a few hours, they're released right back on the street. And we're going to develop a relationship with the hospitals where they're going to contact CORE when that happens. And if we're available, we're going to try to meet those people when they come out of the hospital and see if we can get them into services right then.
And so, from a practical standpoint, how would this work for, let's say, the everyday person? They see an incident that's happening, say, in Waikiki or in downtown. What does that process go through? I think a lot of it would also have to be educating the public about your services and how they can utilize this and how to help to, bridge the gap between these services.
Yeah, the best way to contact CORE is through 911. We will have some dedicated phone lines when we get the headquarters up and running. It's going to be in the old fire station in Iwalei, and we're just moving in there now. And we'll get all that out. And I appreciate that comment. We need a lot of public education. The reception so far has been great. We've had people call 911 and say, we want that group with the red shirts, right? Because they come in jeans and red shirts. And so, they don't give citations. And so they're approaching people differently. And I think that, I think people really wanted this. I'm not giving enough yet. And so we're going to do that. We'll gear up. We'll have 4 trucks by the end of the year. And right now we're in downtown in Waikiki. But, as we build this up, we're going to spread out into the islands.
Yeah, and following up on that, let's talk about sort of what happens when someone does call 911. When Dr. Ireland was on here, he said that there are some individuals that end up in that cycle that you were referring to, where they end up in the emergency room and then they end up right back on the street. And he said there are a couple individuals that they see so regularly. One, he said 80 times in just a month going to, use EMS services. The EMS only has 21 rigs to service the entire island, and we know how stressed our paramedics and hospital workers are. So that certainly is a misuse of those resources. So how are you breaking that cycle? As Ryan said, someone calls 911. The CORE, the folks in the red shirts are dispatched, and then what happens?
Well, I think that if we're dispatched to a situation, that the key is that we approach somebody with the feeling that we want to help them, not control them, that we want to help them. And that was very evident when we put together the planning team. And I think I mentioned this. We had the city departments, HPD, but we had 2 members from the state, housing and home, the homeless coordinator, and also the Department of Health. We had some providers, but we had 2 individuals on the committee that were homeless. And they provided scenarios of what the window looks like on the person receiving help when someone's approaching them. What is happening there? And that really helped the approaches that we're going to use. And so, there's dignity involved. Approach somebody with dignity, and also, we want to help them. A lot of them have medical issues, right? They cuts and all sorts of infections and things like that. But the key is we can spend time and we can build trust. And we may not get somebody to make a decision on the street the first time, but maybe the second time or third time, or just staying with them for a while can help, right? And then again, if we take them to the hospital, or if the police have or EMS has, then we can also coordinate ourselves to meet them and again offer them services. So we're gonna contract with some service providers to always have a bed available, and then we're also going to coordinate ourselves into the networks that are already there, CARES Hawaii and all the different service providers. So we're really triaging people into the service system that we already have.
And what is the HPD's role in this? Because I imagine that on some of these calls, some of these homeless individuals are suffering from mental health issues, and it can get violent at times. And we've seen incidents of fights breaking out and different situations where the team itself, the core team itself, could be in jeopardy physically. Is HPD's role in this going out along with the team, and if you can explain more about how their role would be moving forward?
That's an excellent point. The situations, if the police go out, they may go out and see that this situation isn't violent, and maybe then they would call CORE, and CORE could come and relieve them. At the same time, if CORE goes out, and these are frontline people, and they're trained, just like when EMS comes out, right? If they see the situation and it looks like, it's going to need police backup or police in front, they'll call the police. And that's what CORE will do. It'll bring police in. And then sometimes we'll go out together, kind of a blended approach. So, I think that we're going to divert some calls from police, but we're going to be interacting with them on a regular basis with this. We think it'll have productivity, but what we really want are the outcomes, right? How many people we're dealing with, how many people we're getting placed, how many people are taking services, how many people can we talk into and confer with and give advice to accept the services that we have, which isn't easy today.
Mm-hmm. I would think that, at this point, a new approach is very welcomed by so many in our community. I'm interested to know about the dollars and cents of all of this. I know it's ARPA money, so I believe that can be used over the course of, I believe, the next 4 years. You'll have to correct me if I'm wrong, but what's the sort of longevity of this program, and how much money is the city investing in it with those ARPA funds, which, for people who don't know, it's American Recovery Funds that come from the federal government?
Right. That's a very important point, because I did a startup company, right? And if you're getting funds from people and collecting investment, at some point in time, if you can't convert to revenue, it's really hard to keep something going. And so CORE it's going to be started up for $4 million in the first year from ARPA money, and then I've also made an application for congressionally directed funds for it to support that. And we'll find out before the end of the year. But that said, the managing director and I have already started conversations about what do we do 3 years from now? Is this program as successful as we think, and we want to make it a permanent division within HESD, then how do we do that? And what are the mechanisms to do that? And we're looking at that, because I believe that this program is something that we want in the county, and I think our people want it. And if that's the case, and we spread it out, and we really get it working well, that we'll see it almost like you see ocean safety, EMS, and CORE.
We've seen many different attempts over the years by different administrations and by different leaders in this role to tackle this issue of homelessness. What makes you think that this issue, this resolve and this plan is different than others that we've seen in the past?
Well, again, I think we were limited in two areas. One was we were limited in that decision making on the street. And the other is the previous administrations had relied on the HUD model of housing first. And the housing first model is you house somebody and you surround them with services. And that's how you get them off the street. And that came out about 15 years ago. Everybody bought into it. And mayors around the country wrote papers about how homelessness was going to end in 10 years with housing first. Housing first does work. And we get a lot of money from HUD to do that. And so we're going to continue to do that. But it doesn't work everywhere. And if you only are doing housing first, then you're missing large groups of people. And so I think that we need to build more. Well, first we need to build more housing that we can house people. That's paramount. In addition, I think we need to build transitional housing, so that people have an opportunity when we can get them off the street, and we can use leadership within our communities to do that. And we've seen that happen. And we get them into these transitional housing villages, that they develop a sense of community. And that's part of the healing process. And then when they have something they can relate to, like that sense of community, when we can move them along back into housing, they have this belonging, like we all need, so they can function. And there's a transition that happens from victim to then taking control as you move on. And that's what we really want, right? I mean, it's not like we should just be giving somebody everything, right? Train them, get them on, help them achieve their self that they want to achieve, and help them do that. But they have to achieve, right? And that's what we're trying to do. So I think a broadness of approach rather than just housing first. We're gonna come at this thing in many in different facets like that. Transitional villages is one of them.
How large is this problem? We know that just anecdotally, you walk down the street, you definitely see in some pockets of, communities like Waikiki in downtown that Ryan was talking about. But because of COVID, of course, the point in time counts didn't get to happen in the way they have in years past. How large, how many people are you anticipating needed to respond to? Will the 2 to 4 rigs be enough?
Well, like you said, you don't know the numbers, and even with point in time counts, that probably the consistency of doing it the same way gives you a consistency of numbers. But it's hard to say. I think that we're doing things differently that are already making a difference. I'll give you an example. In like I said about the housing now with vouchers, we the housing now with the HUD money, vouchers were used the same way, and so they were only targeted at the most chronic homeless, right? And so when I got here, sort of a business attitude, why don't we do market segmentation? Why don't we look at this? We have different people that are homeless. Every person's an individual, but at the same time, there's groupings, right? There's families. There's people who just became homeless. There's people that don't want to be homeless, right? So why don't we house them? Why don't we help them get off the street? And then we're dealing with smaller numbers, right, to deal with. And so our Oahu Housing Now program that this administration has put forward has housed 600 people this year, right? 225 families. And the only problem now is we have 83 more families that we could put in housing if we could find the apartments that would take the vouchers to use them. So, there's that's what I said. So you look at the decision on the street, and then you look at capacity. And I'm trying to look at capacity in different ways to give us more options than we had before.
You mentioned the villages as a part of this overall plan, and over the years we've seen this sort of model increase. Of course, Kahuiki Village by the airport. There's also the village that has been stood up in Kalailoa, and we also know of what's happening out there in Waianae. Well, with members of that community actually being involved in building their own homes as well. If you can speak to these villages, is this something that the city sees a future in? That you may be investing more in this, looking for private partnerships to help to increase this sort of housing for those individuals?
Well, I think so. I think that the thing to recognize, though, is when some of these villages went up, they went up under the governor's proclamation on homelessness, right? So it made it easier to get them started. And so it's a little more challenging right now. And I'm trying to build a framework that will allow us to do it. But yes, we're going to invest in this. I have a couple of properties that we're doing assessments on now. And one of them really has a forward group that could bring people in right away. I think one of the things that the villages offer is they combine with communities that have the leadership that draw the people into the village rather than a government organization, coming up and offering services. And I think that's the difference. And I think it's the beauty of it.
What kind of changes have you seen in terms of numbers with the pandemic? We know that there was this anticipation that we would have this wave of evictions once the moratorium was lifted. Has that come to pass? And are you seeing people that are, put out on the streets as a result of what's happened to the economy because of the pandemic?
So we were very nervous. It was a thing you can't predict, right? Because you don't know how many, or you don't have any numbers. You're going to have to react to an eviction notice. And so we were gearing up quite a bit for that, both with legal responses and everything else. But, the Office of Economic Revitalization, I just got a note from them. They've helped 9,300 families with rent relief and utility relief, right? They've given out more than $90 million to people to help that problem. And I think the reason why we haven't had the kind of problem we had that we anticipated that was a potential was because of their efforts. In fact, they've been recognized nationally for how well they've done that. Now, that said, sometimes, things don't happen on the date of announcement, so you got to keep monitoring this thing. The results could be in a year, could be 2 years. So we do notice from the COVID analysis we've done, and AUW does this thing on the Alice households, right, which are 1-2 paychecks away from losing their house, right, and that's increased by almost 30% since before COVID. So in Hawaii, we have over 50% of our households are like that. And that's a very precarious position. And so we have to stay on top of this, right?
One of the things that we're also seeing are homeless people in different communities. Where right now, is there any way to measure where most of these homeless individuals are and where others are now finding themselves moving towards? We do know that there's reports of many more in the Diamond Head area, and there's also people even moving on into the Hawaii Kai side of town. If you can explain a little more about if there's a general area of the island that we're seeing more homeless individuals.
The biggest population is urban, the Waikiki, Chinatown, Kali'i area. We have some large groups there. At the same time, we have this program called HONU, and we put in a second HONU this year, and it went up to Whitmore. right? And it was very successful. It housed over 60 individuals. It returned, in addition to that, it returned 11 people back to their families and such. In Carson Thop Bridge, that used to, at one time, there was an estimate there was 175 people living underneath that bridge. We almost totally cleaned it out. And so, we cleaned out those structures that were almost permanent. So, there's pockets where there are, and I think I've had people say, no, my street's better now. It has improved, but there's a big mountain to climb, and we need to keep working at it.
The last time you were on, we talked about homeless shelter capacity issues, just with COVID and social distancing and trying to be careful and not spread the virus. The bed capacity had been limited. Can you give us an update on what the situation is with the shelter capacity?
Yeah, in the shelter capacity, I get a report every day, and it's about the same. It's stuck. And so when the Delta variant hit, all the shelters almost stopped taking in new people. So what we had to do is we doubled the capacity out at KE Lagoon, and we doubled the capacity so we could take those extras. So we've almost like 30 more spots are being taken there, and we have other places for that HONU to go to, and we won't. We need to see the shelter starting to open up again, and that hasn't happened yet. So hopefully we'll start seeing that soon, and then we'll get some flow in the shelters. But they're almost at capacity. There's a few spots open, and it's not moving and then we're taking the overflow. The city is in the HONU program.
I want to circle back to what we started this conversation with, and that was your role and now your dual role in serving as the head of these different departments. There is the administration obviously sees you as a valuable asset to help lead these two entities. But there is some within the city and county who don't believe that merging these two departments is the right fit right now or the right plan of action. Well, what are your thoughts on maybe the hesitation there?
Well, the Office of Housing, and which we wanted to be the Office of Housing and Homelessness, really is an office of the managing director and the mayor. And so it is an office is the one that's supposed to help the departments coordinate, especially the affordable housing plan. And we'll continue to do that from the direction of the MD. And so we meet on a regular basis, and we build the documentation for the affordable housing plan, which is the culmination of, Department of Planning and Permitting, the Department of Land Management, and Department of Community Services. But I also think that coming in and being the director designate for community services, and hopefully the director, that I'm going to facilitate a department that's going to be very collaborative with the other departments. And so working in these silos that are clearly there when I got here is I'm going to try to be an example of not that. And then I think we can do that. And I think the other directors are dedicated to do that. And that's very different because we have these joint meetings run by the managing director. And then I kind of work them from there. That's what we're doing. And so I think that's very important. Affordable housing is at the crux of many of these issues. And it's a very tough problem to address in Hawaii with our cost of living.
We are almost out of time, but I want to get your thoughts on just being in the role you are now. We know you came from the business sector, and this is your first real foray into government. How has it been so far? I mean, and now you're basically running two city departments. It's got to be some big changes for you.
There's a lot more paper. Things don't move as fast. I mean, I wanted core in July. So I said August because I thought that was reasonable, and then it didn't get launched till October 15th. So I think it's that. I have not just been in one position before. I have run a division for a company and then worked on another company at the same time. So I do have some experience of doing this kind of juggling, but it's a lot to do. But the mayor's asked me to do certain things, and I serve at his request, and I'm glad to be doing it.
And as we look forward here, what do you think? I mean, you touched upon what lies ahead for CORE with the addition of new trucks and what you hope it will become. But realistically, as you look down the line here at maybe the first few quarters of next year, what are your hopes for that program, and what are you planning for as we move forward here?
Well, I think in terms of CORE, that we want to establish it to the point that everyone expects us to be there, just like we expect lifeguards to be there, just like we want EMS to be there. So we'll do that. And I think it'll be able to do that. I also think that we have to manage our streets. I mean, there is a concept that says people come to Hawaii because the weather's nice, and we're seeing an uptick in numbers since things have opened up, and it's easy to get benefits here. But if the third piece says, hey, and you could just live anywhere, nobody cares, then that's a bad thing to do. And I think we need to continue to manage our streets. I think Weed and Seed sends a good message there. And we're coming out with a different coordinated cleanup response that will really be focused on cleaning up the streets, not the individuals on the streets.
Okay, Anton Krucky, thank you so much for joining us this morning. It's great to get the update on the core program. A lot of us will now start looking for those individuals in the red shirts. We appreciate your time this morning. Thank you.
Thank you so much.
Thank you. Aloha.
Well, great to hear progress with that program. There's so much optimism about it. As you heard him say, they launched on October 15th. They have 2 rigs and a limited staff right now, but they are expanding eventually, hoping to be headquartered in a separate division and actually be taking some of those 911 calls. I'm assuming they get diverted from 911, but in the meantime, the main switchboard is handling those. The idea being that you would have a team of social workers and medical professionals to go out to respond to individuals who are perhaps chronically homeless and are facing challenges that are not properly responded to by the police, and so that they don't end up in a situation like Jim Ireland was telling us about, where they have one person going to the emergency room 80 times in 1 month. That's a strain on resources that obviously we don't need, and is not serving that individual, because obviously if he keeps going back, they're not getting the care they need. So a lot of hope for this program.
Yeah, and you heard from him saying that he hopes that this becomes a permanent fixture within the city and county of Honolulu, and a service that people can rely on, much as many people do with EMS, with what we see on the beaches with lifeguards and services that are made available there, that this core program becomes so much more than just a band-aid, but really a part of the evolution moving forward on how we tackle some of these homeless issues. Also him saying that, I thought the interesting note was that these rigs not only will respond, but also maybe circulate and drive around the areas and patrol those communities where we see more of those homelessness, to make sure and ensure that things are safe and that they are addressing the needs of the community in those areas where we tend to see more homeless individuals in the urban core.
Right. That really speaks to the last piece of what he was talking about, this idea that you can live on the street and nobody cares. Obviously, we all do care, and having those patrols would be really instrumental in changing the dynamic for a lot of communities. So we're very hopeful on that. And he's managing a lot of other things as well. Of course, now the director designate of the Department of Community Services, he talked a little bit about housing vouchers and all the work that's being done to make sure that people don't become homeless. The affordable housing piece is a big one. And then the villages that you asked about is very interesting as well.
Yeah, a lot of different components that go into these issues. And I think of one of the things that he's trying to do is educate people as well about the different layers that we are seeing out there in the community, that it is not a one-size-fits-all program that is going to cure everything, but there's a multi-level approach with many different partners that are involved, both on the public and private side. But again, this continues to be an issue that has plagued many leaders. It's talked about almost every campaign season, whether it be from homelessness to affordable housing. This continues to be an issue, and will be another topic that will come up once again as we enter this next election cycle.
Absolutely. And we're going to invite Anton Krucky to join us again in a few months so we can get an update on CORE. On Monday, we've got an interesting guest. We'll be talking to former Honolulu Mayor Kirk Caldwell. No doubt he will be part of this upcoming election cycle, as we all know. When he was on last time, said he was doing a listening tour, if you will, going to all of the islands. We're going to get some results from that. What has he been hearing on those tours, and talk to him about his political plans. We really look forward to our conversation with the former mayor right here on Monday.
Yeah, we'll see if we get some kind of announcement out of him on Monday. But until then, have a great weekend and stay safe. We'll see you right back here at 10:30 on Monday. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.